Rheumatoid arthritis is a type of autoimmune disease which affect not only the joints, it affect any part of your body. So there is a lot of inflammation is going on because of autoimmune mechanism, and this is 100% treatable if we catch them early and treat them. The moment this diagnosis has been done early, you will have normal joints, normal body, whole life with the medicine. You got very effective treatment for these conditions. But if it is not treatable, then what is going to happen is your joints will be damaged. Your other organs like lungs, you may develop lung fibrosis, heart will be weak, kidney will be weak, eye will start getting dry. When you look at the symptoms of rheumatoid arthritis, the early symptoms what we're looking for is a persistent joints pain involving multiple joints. Joints which are mainly involved in rheumatoid arthritis are hand, feet, elbow, wrist, shoulder, knee joints. Joints will be inflamed, they will be swollen, there will be like a burning pain coming up, and there is a restriction of movement. When patient of rheumatoid arthritis, they get up in the morning, joints are very stiff. They take around 1 hour, 1.5 hours or a good shower to feel free. So early morning stiffness in these type of patients are very important to diagnose. So any patients who got a joints pain which is persisting for more than 6 weeks or 4 weeks with early morning stiffness, they should consult a rheumatologist preferably. Rheumatoid arthritis can also be associated with a lot of systemic symptoms like fever, like skin rash coming up, dryness of eyes coming up, shortness of breath coming up. So all the part of the body can be involved. But technically we defined where the people age is more than 16 to any age. It can happen in early. Primarily this rheumatoid arthritis affect young women of reproductive age group. So this is important. Rheumatoid can happen in early age less than 16 also, but in that situation we call is a juvenile idiopathic arthritis. Good thing about rheumatoid arthritis, everybody thinks, okay, you need plenty of tests. You don't need any test. What you need is your checkup with a doctor. Just clinical examination, doctor will suspect. Your doctor may request few tests. And these tests are routine tests and some marker of rheumatoid arthritis to look at the severity we do. Like rheumatoid factor we do and the anti-CCP antibody. These are very specific for rheumatoid arthritis diagnosis. But just remember, there are so many types of arthritis. So it's just not one blood test where rheumatoid factor is positive and you're having joint pain necessarily constitute rheumatoid arthritis. Unless synovitis is documented, your inflammation in the joints is documented by the doctor, this may be something else. So for treatment, what is required is control the cell's autoimmune mechanism by giving some immunosuppressants. Not just giving painkiller to control the joints pain. That's a symptomatic treatment. So in last 20 years, the treatment of this arthritis has totally changed. Earlier, people are very scared because they used to think, okay, arthritis treatment means steroid. This is no more the case. You got disease-modifying drugs. They are harsh a little bit, but with a proper use, they are very effective. Your joints will be back to normal within 4 to 6 weeks and they will remain normal. If conventional disease-modifying drugs are not effective, then we got other higher drugs. They are biologics we use. They are very effective. Nowadays, for last 4-5 years, we are having another group of drugs we call as small molecules or JAK molecule. They are oral tablets.